Good afternoon. My name is Derek Kitchen and I'm the Managing Director of Midlands and Lancs Commissioning Support Unit. I'd like to thank you all for attending our Platform X Customer Forum today. This is the second in a series of events that we've been running to tackle the challenges our partners are facing as the NHS looks to restore, recover, renew, cope with COVID-19 and winter pressures, amongst other operational challenges. Today's event is going to be recorded and each of the sessions will be available to share and rerun via our website, and we'll give you the access to that later. Last time we discussed our work on elective care and waiting list management, a really good 1-hour session. Today we're delighted to be sharing with you our experience and learning from running improvement programs. We do these nationally, regionally and locally, and we want to show the approach we've taken to transforming care pathways across systems. To be able to do that, I'm calling on two experts from within the CSU today from our improvement unit, Ratna Taylor, who is the head of the unit, and Senior Improvement Consultant Helen Stubbs. Together we'll give you a brisk look at what's involved in running an improvement project to achieve sustainable results. We'd also like to hear from you during the session, and if during each of our presenters' sessions you care to raise a question, then please hit the speech button at the top of the screen, record your question, and we'll consider that in the panel session following the presentations. The three take-home messages that we want you to hear today are: be bold. The opportunity to make improvement when it's needed, take that opportunity. It will never be right or the perfect time, but improvement is always needed. Use rapid improvement approaches to improve patient experience and outcomes. They really do work, and we will show you how. Do call on our experts to support you in running your programme or in creating your own internal improvement capacity. We are NHS professionals. We work within the NHS, of the NHS, for the NHS, and when we work with systems, whether that be national, local or regionally, we like to leave skills behind rather than leave it in such a way that you need to come back to us. So with all that in mind and those take-home messages, I'm now going to hand over to Ratna. Thank you, Ratna.
Thanks a lot, Derek. So I guess the easy answer to the question posed by the title of this session would be no. But what we'd like to advocate for is the benefits of running a rapid improvement programme, and there are a number of reasons for this. So firstly, with the intense pressure that currently exists in all health and care systems, it can be argued that we don't have the time or resources, whether they be physical or financial, to run major improvement or long-term programmes. Also, we need to consider the emotional resilience of our teams, especially given the challenges our staff have and will continue to experience during the COVID-19 pandemic. We also need to design improvement programmes that will minimise the time, disruption and resources required whilst maximising the impact. So rapid improvement programmes really lend themselves to being delivered in bite-sized chunks. Start small, test, prove and then expand across the organisation. They are most impactful when focused on specific issues rather than wider service improvement. And the cumulative impact of a number of small targeted improvements can ultimately be very significant. And finally, the most effective rapid improvement programmes are the ones where they're designed and delivered locally. And the most powerful and sustainable improvements, in my experience, come from the shop floor. Here's a short video clip of an NHS senior manager talking about rapid improvement projects.
So allows people to have a go at something, gather the evidence and then be able to move that forward. For me, it's an opportunity to collaboratively get people together, agree what changes they want to make and have a go at changing it.
As an improvement specialist, we can design a range of improvement interventions and programmes, but doing this in splendid isolation will have minimal impact. Improvement is at its most powerful when it's designed, implemented and sustained by those involved in the day-to-day delivery of each service. There are some key principles that I would like to explore. The role of the executive sponsor is not to be like the Queen, gracing the team with their presence at the opening and closing down of a project. They have a key role to play throughout the life of a programme, however long this is. Their involvement validates the Rapid Improvement Programme, and they have a vital role to play in unblocking barriers and also facilitating access to resources, whether that's physical or financial, and endorsing the outcomes, whether this is a new process or a new delivery model. So we'd just like to show you a clip of a CCG manager that we've previously worked with.
The main thing has been the permission to just get on and try something, and equally it doesn't matter if it goes wrong, so there's no expectation of something that's going to either improve outcomes or save financial benefit. It's although they are the ideal, it's really just a case of working together a bit more collaboratively, and it's the pace that really enables you to do that.
So ideas generation. At the inception stage, there are no bad ideas. Using affinity diagrams will help organising the facts, opinions and issues into natural groups. This clustering will help identify common themes and diagnosing issues which can then be prioritised. This is a very inclusive process and no one voice should have greater weight. We found that independent facilitation of those ideas generation sessions is also helpful, as this will ensure that all voices are heard. In relation to time, rapid improvement programmes can be at any point up to 100 days or 3 months. Any longer than this will run the risk of losing momentum or resources. 5 to 7 day events can be powerful, and this is the typical requirement of a Kaizen event. A Kaizen event is the improvement term used to define any intensive project where people are typically pulled off their day job for 3 to 5 full days. Value stream mapping will also help you consider the improvement journey from multiple perspectives and will allow you to identify the current state for all involved and design the to-be map. It will also allow you to quantify time savings and improved quality, for example. So now I'd like to hand you over to Helen Stubbs, who's a senior improvement consultant within the improvement unit. Helen will take you through impact and sustainability. Helen.
Thanks, Ratna. Good afternoon, everybody. So I'd like to talk to you about two of the key areas in any improvement programme, impact measure and sustainability. When undertaking rapid improvement projects and as part of the impact measure, there are several key points that you need to consider. The first is baselining. It's vital that you do this at the start of your improvement programme. This will allow you to quantify the impact of your improvements. It's also really important to undertake daily and weekly goal setting. This is essential to not only maintain the pace of your improvement programme, but to also help identify if there are any unintended consequences of your programme. These can be either positive or negative, but either way, you need to identify them early on so that they can be capitalised on or mitigated against accordingly. And it's also really important to create and encourage a culture of organisational learning, continuous improvement and capacity development. So the following slides will show you some real examples of benefits where we've helped clients to realise through rapid improvement programmes real benefits in a very short space of time. So in central Lancashire, they ran a pilot which saw patients with urinary tract infections treated in ED and surgical assessment units, and then discharged with a care plan in place and a follow-up referral to urology specialist nurses for trial without catheter in an outpatient setting. In the first month, 9 patients had been discharged under this new pathway, saving 15.66 bed days. This intervention also helped avoid unnecessary admissions and transport between the 2 hospital sites, whilst improving patient experience and reducing the risk of hospital-acquired infections. The intervention is now no longer a pilot. It was very quickly adapted and adopted into usual customer practice across both hospital sites. So the next pilot was run in Doncaster. In Doncaster, they'd already prioritised reducing paediatric DNA rates in ophthalmology. And in order to do this, they increased the accuracy of their patient contacts by engaging with referring organisations. They promoted the checking of details each time a patient had contact with the service, and also looked at improving efficiency with other approaches such as self-service kiosks and new appointment letters and notifications for employers and schools. In addition, they actually engaged really well with the schools to educate the children about the importance of keeping appointments. And they did this by running an appointment letter competition for the children, which proved to be really engaging. Again, in Doncaster, they also had a look at making changes to their MSK spinal pathways, in specifically towards their care navigation first to physio pathway. The aim of this project was to increase the referrals to an existing underutilised physio service. Patient involvement in this particular pilot was led by HealthWatch, who also helped produce new patient information documents and to promote the service. And as the great Mark Twain is quoted as saying, continuous improvement is better than delayed perfection. And I think that's, you know, we can all agree that's really quite pertinent and very, very true. So moving on now to sustainability. We recommend that you make use of the Sustainability NHS tool. This diagnostic tool has been developed to support healthcare leaders to identify strengths and weaknesses in their implementation plans, and so predict the likelihood of sustainability for their improvement initiatives. We've used this particular tool on a number of occasions to great effect, and in order to understand a little bit more about the model, I recently spoke to a colleague of mine who has used this tool to support NHS organisations with their own improvements, and I'd like to just share that conversation with you now.
To speak to me today about the NHS Sustainability Model tool. I understand that it's helping a lot of NHS organisations to understand how sustainable their changes and improvements are going to be, but it'd be really useful to understand a bit more about how that tool actually works.
Hi Helen. The model tool was developed by the NHS Institute for Innovation and Improvement, and essentially it identifies the key factors affecting sustainability of change. There are 10 factors in all, which are grouped under 3 themes of staff, process, and organization. And each factor receives a weighted score, and you could score a maximum of 100 points. Now, if you score 55 or more, then that should make you optimistic that the change you're looking to implement is sustainable over the long term.
Okay, so in terms of the organisations that you've worked with who have already started using this tool, could you tell me a little bit about how you supported them?
We worked with the ICS in Doncaster, and what they wanted to implement was a new pathway within their ophthalmology specialty. So this tool was used to support a business case that went to their executive board to essentially introduce this new pathway. And just the way that the tool visually shows the areas that you need development, or you know how they can address some of the factors for sustainability was really powerful in helping them make that decision. It's also been used in the Northeast with one of the acute trusts there, where they were looking to move activity from their hot site to their cold site, and the improvement team in that trust have adopted this into their standard way of working. So it's one of the suite of tools that they use now. Any improvement or change, they run it through the tool, and that gives them a guide of the areas that they need to address to make any change sustainable.
That's really encouraging to hear. So not only has it helped them with a specific piece of work, but they're actually embedding it into their processes and using it on a regular basis to help guide changes and whether they're sustainable.
The feedback has been really positive, and it's great to see this having an actual impact on patient care in the real world, rather than just being a theoretical tool.
Yeah, no, that's really encouraging to hear. Thanks ever so much for that, Gordon. I really appreciate you talking me through that.
It was my pleasure. Thank you.
Thank you.
Going to very much take the ethos of this 100 days forwards and really apply it to all the other projects that we do. However, these specific 3 projects that we've done, we've very much got objectives to take these things forward. There's still a little bit of work to do for each of them, but yes, very much take them forwards to business case and get the infrastructure in place. So yeah, we can take them forwards and have them sustainably implemented.
So I think crucially, one of the main points to elaborate on in relation to sustainability is that they should not be reserved for project close down. They're far more effective if they're used from the outset of your project and your improvement initiative, as they can provide you with valuable understanding of where you can strengthen the work in order to maximise the potential for sustainability. The model should be used regularly throughout the project to focus on efforts on improving the project's sustainability total score to enhance the likelihood of sustaining the improvement beyond the life of the project. We've included the link to the tool in this pack. I would absolutely encourage you to go and download the tool. It's editable and I'm sure you'll find it very, very useful for your own improvement initiatives. I'm going to hand you back now to Ratna, who's going to take you through some final thoughts.
Thanks, Helen. So I've just got 2 final thoughts that I'd like to leave you with. The first one is permission to fail, but fail early. It's important to recognise the significance of clinical service or patient-facing improvement challenges. The risks here can be in part mitigated by clinical colleagues' involvement at early stages, and also throughout the life of a programme. I know that access to the time can be challenging, but this will be essential, as will learning from any bumps in the road of an improvement project, combined with an ongoing awareness of the unintended consequences and how to respond to or mitigate against negative ones, but also how to capitalise on positive ones. Secondly, patience. For some, their involvement can be a real thorny issue. We are the professionals, after all, whether clinical, operational, or in my case, being the head of an improvement service. However, as a consumer of health services, I would like my voice to be heard, as well as my experiences to be acknowledged, and factoring in patient engagement at key points during your improvement programme will increase its impact and sustainability. And as we know, COVID-19 has further exposed some health and wider inequalities that persist in society. The virus has disproportionately impacted on certain sections of the population, including those that are living in the most deprived neighbourhoods and people from BAME communities. And it's essential that improvement programmes are planned in a way that is inclusive and supports those in greatest need. So in answer to the question posed at the beginning of this session, is there ever a good time to run an improvement programme? I would say the answer is now. So in conclusion, I'd just like to hand back to Derek, who has some final thoughts. Derek.
Thank you, Ratna, and thank you, Helen, as well, and colleagues that have helped you putting this presentation together today. And thank you to those who are attending and who will be watching this video, hopefully in the future, for giving us the opportunity to share with you just some of the work that we've done and undertaken in systems that have really driven change and transformed patient pathways. Listening to the presentation just now, I was struck by a point, and as people know, I will use analogies and take examples from outside of the NHS. And the point about making rapid improvement at a point as you are actually delivering struck with me. And for those of you who watch football, how many times have we seen a team go in struggling at half time and 15 minutes later come out and have a much better second half with vastly improved results and performance? Just a little analogy there to help make the point. I set out for us to make 3 points today, to make 3 key messages. One was be bold. We won't achieve anything unless people are bold. Always use rapid improvement approaches to make improvements They really do work, and please do call on our experts. We would love to be able to help you, support you to make improvements in the delivery of your services to patients and the wider population. Thank you very much indeed. So I now believe we go into the questions and answer session. We're a bit light on questions actually for those who have been listening and hopefully taking part and thinking about what questions they could ask. Ratner, if I could ask a question, we've talked about for obvious reasons the impact on patient pathways and improvements in outcomes for patients, but surely I'm right in saying that this technique will apply to, if you like, services that are not directly related to patient care and services, and could in their own right make an improvement in patient care down the road?
Hi Derek, yes, I think that's a really good point, and certainly what we've done when we've done improvement pieces of work in areas that are traditionally not seen as frontline patient facing services, we've tried to run through, it's almost our core values around putting the patient at the centre of everything that we do. So, for example, when we've looked at things like HR services and improving HR services, you could think that you work in HR, you don't touch a patient, your impact is 2 or 3 steps removed from a patient. But how I like to see it is that, you know, if we can improve a HR process, that means that we can increase the efficiency of recruitment. That means we can reduce the time it takes to get clinicians and people that are in patient-facing positions into their work, then we're having a really, really positive impact. And that analogy can apply to things like finances, to data analysis. It's often you feel slightly removed from a patient, but it's just reinforcing that whatever decisions you take and whatever improvements you make, 2 or 3 steps further down the line, there will be an impact on the patient, and certainly ensuring that it's a positive impact, but also learning from some of the inequalities that has been exposed by COVID, making sure that we don't design an improvement intervention that disadvantages any particular or any discrete community. So certainly factoring that into improvement design and implementation is really, really important.
Thank you, Ratner. And I'd just draw on that, on your answer there, and seeing the slide that we've currently got showing in terms of the other services that we as a CSU offer. I think it's probably worth making the point that the more at scale and the more streamlined back office services that we can have within the NHS, then it follows that will increase the resource, both in terms of money that is available to treat patients, which, given your reference to COVID-19, is surely something that we should be looking to maximise during the following months and years. I'm watching the boards, and we don't appear to be having many questions come forward. I'd look to Ratner and Helen. Is there any other points you'd like to add before potentially we bring this to a close?
I think for me, Derek, I think.
Carry on, you there?
Sorry. I think for me, it's really important to have some very open dialogue with all those involved in improvement projects. All suggestions and any ideas can be fed into an improvement initiative. And often those, you know, the best suggestions come from the people that actually live and breathe the service, as well as those that are the users of the services. So again, you know, you can open that question out to service users, as well as people within the organisation and other stakeholders. And I think for me, having that inclusivity and hearing all the voices is quite key.
I think that's a really, really good point, Helen, and absolutely the end user experience, to use a very old-fashioned phrase, will always be very helpful in terms of looking at how we offer services, review services, and make those improvements. Can I put you on the spot, Helen, and
yes.
ask an awkward question?
Okay.
You know me well enough to know that sometimes I get impatient. We have massive priorities as an organisation, as I'm sure all organisations do, and leaders do within those organisations. If you came to me with an improvement project, and I turned around and said, we really haven't got the bandwidth or the time for this, and we're heavily under pressure in terms of resource, what would your answer be to me?
So I think I would very politely challenge you on your response. I would want to have that discussion with you and show you that by undertaking the initiative, the benefits absolutely will be far-reaching. So they'll impact on capacity, on resource. They'll, potentially have the potential to free up additional capacity and resource that could then support some of the greater pressures that we're already experiencing. So I think having that permission to have that conversation with you and understanding what the benefits are likely to be, I think that would be my response to you, would be to say, well, actually, I think by doing this, we can get greater benefit and support some of the other priorities within our system.
So I think the speed and the clarity and the passion of that answer is a great place to leave the messages today, Helen, from somebody who lives, breathes and eats this. So thank you very much for that. In the absence of any other questions, we don't look like we're going to be having an open discussion today, I don't think. I see no hands, I see no questions. I'd like to thank everybody for taking part in that, those who've listened and those who've presented, and like to draw this to an end, and we will see you again in early December with another one of these Platform X webinars. Thank you very much, everybody, and have a good weekend.
Thank you.